Have you ever heard the term fungal acne and wondered if it's the same as regular acne? If you're like many people, you might have seen this term trending on social media or discussed online, but there's something important you should know: fungal acne isn't what you think it is. As a dermatologist, I've spent years studying skin conditions, and when I first heard about fungal acne, I'll admit, I was skeptical. I thought, wait, did I miss a whole chapter in dermatology residency training? But after some investigation, I realized that fungal acne is not actually acne at all. The term is a bit of a misnomer. In fact, what we're talking about is Pityrosporum Folliculitis, a condition caused by a type of yeast that affects the hair follicles on your skin. In this video, we'll delve into what fungal acne really is, how to identify it, and most importantly, how to treat it effectively. Whether you've been dealing with stubborn bumps that don't look like traditional acne or you've just heard about this condition, keep watching, because understanding the true nature of your skin issue could help you find the right solution. What exactly is fungal acne? Let's start by breaking down the term fungal acne. First, it's important to understand that while the symptoms may resemble acne, the causes are entirely different. Traditional acne is usually caused by clogged pores, an overproduction of sebum, skin oil, and bacteria that thrive in those clogged pores. On the other hand, fungal acne, or Pityrosporum folliculitis, is caused by an overgrowth of a type of yeast called malassezia that naturally lives on our skin. This yeast thrives in oily areas, which is why Pityrosporum folliculitis often appears on areas with high oil production like the chest, back, and even the face. It can also appear in areas where sweat accumulates, such as underarms and the groin. Symptoms and differences from acne. The most prominent symptoms of fungal acne are red, itchy, small, uniform bumps that look like a rash or acne. However, unlike traditional acne, fungal acne typically doesn't come with the typical pimples or blackheads that are the hallmark of regular acne. The bumps caused by Pityrosporum folliculitis can feel inflamed and may itch intensely, but they don't develop into the deep cystic pimples associated with traditional acne. In my years of treating patients, I've seen many people confuse these bumps with acne, thinking they just need stronger acne treatments. But in reality, using regular acne products like benzoyl peroxide or salicylic acid can actually worsen fungal acne because they can dry out your skin, which feeds the yeast. This leads to an even worse overgrowth of the malassezia yeast. How does it develop? So, how does Pityrosporum folliculitis develop in the first place? The yeast malassezia is naturally found on everyone's skin. It's part of our normal microbiome, and usually, it doesn't cause any issues. However, when conditions like excessive oil production, humidity, sweat, or tight clothing create a warm and moist environment, the yeast can multiply. This overgrowth leads to inflammation and the appearance of those pesky bumps. In fact, I've worked with many athletes and individuals who experience fungal acne due to the warm, sweaty conditions from intense physical activity or wearing tight, non-breathable clothing. This yeast thrives in hot, damp environments, so if you wear tight gym clothes for long periods or leave sweat-soaked clothes on too long, you're more likely to trigger an outbreak. Diagnosis of fungal acne. A proper diagnosis from a dermatologist is the key to distinguishing between fungal acne and regular acne. In my practice, we can typically identify Pityrosporum folliculitis through a visual examination of the skin. If needed, a dermatologist might perform a skin scraping or use a tool called a dermatoscope to examine the follicles under magnification. Many people make the mistake of self-diagnosing and treating this condition as regular acne, which often leads to ineffective treatments and frustration. So, if you suspect you have fungal acne, the best course of action is to see a professional who can confirm the diagnosis and guide you on proper treatment. Effective treatments for fungal acne. Once diagnosed, the treatment for Pityrosporum folliculitis differs significantly from that for regular acne. In fact, antifungal treatments are typically the most effective option. Here are some of the treatment options that I recommend to my patients. Topical antifungals, one of the most common treatments for fungal acne is topical antifungal creams or gels. These treatments target the malassezia yeast and help to reduce its overgrowth. Common antifungal treatments include creams with ketoconazole, clotrimazole, or terbinafine. You can apply these directly to the affected areas, and they usually provide relief after a few weeks of consistent use. Antifungal shampoos. Many antifungal shampoos contain ketoconazole or selenium sulfide. These shampoos are formulated to treat dandruff but can also be used on areas of the skin that are affected by Pityrosporum folliculitis. Simply applying the shampoo to your chest, back, or other affected areas and leaving it on for a few minutes can help control the yeast. Oral antifungals. In more severe cases, oral antifungal medications may be prescribed. These can include drugs like fluconazole or itraconazole, which target the yeast systemically and help prevent future outbreaks. Oral medications are usually recommended when the fungal acne is widespread or doesn't respond to topical treatments. Lifestyle adjustments. Along with medical treatments, lifestyle changes can also play a role in managing fungal acne. Reducing the amount of time you spend in sweaty environments, wearing breathable clothing, and showering immediately after exercise can all help prevent yeast overgrowth. In addition, maintaining a healthy skincare routine that doesn't aggravate the condition is essential. Debunking common myths about fungal acne. There are several misconceptions about fungal acne that I've encountered in my practice. Let's take a moment to clear them up. Fungal acne is contagious. Fungal acne is not contagious. Unlike some bacterial skin infections, Pityrosporum folliculitis is caused by the overgrowth of yeast that naturally exists on your skin. It doesn't spread to others through physical contact. Fungal acne is the same as regular acne. While fungal acne shares a similar appearance to acne, the causes are entirely different. As we discussed earlier, it's triggered by yeast overgrowth, not clogged pores and bacteria. Over-the-counter acne treatments will fix it, as tempting as it may be. Using traditional acne treatments like benzoyl peroxide or salicylic acid can actually worsen fungal acne. These treatments dry out the skin, which can create an environment that encourages yeast to grow. Instead, you need antifungal treatments. Real-life example and lessons learned. I want to share a story of a patient I treated a few years ago, Sarah, a competitive swimmer. She came to me with a rash on her chest and back that seemed to be getting worse despite using traditional acne treatments. After a thorough examination, I realized that she was dealing with fungal acne, not regular acne. The warm, damp conditions in her swimsuit combined with long hours in the pool created the perfect environment for yeast to overgrow. Once we switched her to antifungal treatments and adjusted her bathing routine, her condition improved significantly. This case is a reminder that even with seemingly clear skin, the environment we put our skin in can drastically affect its health. Conclusion, key takeaways. To wrap up, Pityrosporum folliculitis, or fungal acne, is a misunderstood skin condition that is often misdiagnosed as regular acne. The good news is that once you know what it is and how to treat it, you can start seeing improvements quickly. The ultimate lesson here is that proper diagnosis is key. If you suspect you have fungal acne, don't rely on over-the-counter acne treatments. See a dermatologist who can provide targeted, effective treatment options. Remember, your skin is unique, and what works for one person may not work for another. If you're dealing with fungal acne, be patient with your treatment and take steps to adjust your lifestyle to reduce triggers. By combining proper antifungal therapy with good skincare habits, you can manage and even eliminate fungal acne for good. Thanks for watching, and if you found this information helpful, don't forget to like, share, and subscribe for more skincare tips.